Good morning, all. Myself Rajeshwar Das, Assistant Professor, School of Pharmacy, the New University. Today, I'm going to discuss on a topic that is the muscle relaxant drugs. This topic is under the pharmacy syllabus under the fourth semester, Pharmacology 1. Muscle relaxant drug is very common used drug in our daily life, and that is mainly two types. So before discussing the muscle relaxant drug, I want to discuss the introduction part of the muscle relaxant, a type of drug that is used to relax the muscle and reduce the tension, stiffness, and pain caused by muscle spasm or muscle strictly. Muscle relaxants are also used to prevent muscle movement during surgery. There are many different type of muscle relaxants. Some work by blocking certain nerves receptor in the brain or spinal cord, while other act directly on the muscle fiber in the body to relax the muscle. Mainly, muscle relaxants are used to relax the muscle, right? So it's mainly used for any kind of stiffness of the muscle fiber, or it may be used for the any kind of surgery purpose. Mainly, some drug act on the neuromuscular junction by blocking the any kind of neurotransmitter, as well as blocking the various ion to influx and efflux in the muscle for the movement, easy movement of muscle. Depolarization and non-depolarization muscle relaxant are also known as neuromuscular blocking drug, work by the mimicking the acetylcholine at the neuromuscular junction to prevent the muscle contraction. We are seen here, these are the first picture is the neuron, this is the neuron and this is the muscle, and this is known as the neuromuscular junction. This neuron secrete the acetylcholine, and these acetylcholine are bind in the nicotinic receptor which is present in the muscle. As a result, the sodium ion calcium ion efflux occur, and sodium ion influx in the muscle, easily muscle relaxed. So these are the normal phenomenon which is mainly behind the mechanism of the depolarization and non-depolarization muscle relaxant drug. This drug is also known as the neuromuscular blocking because this drug mainly block the this nicotinic receptor where the acetylcholine bind. Now come to the point, depolarizing muscle relaxant. These relaxant act as acetylcholine receptor agonist, opening the acetylcholine receptor ion channel and depolarizing the motor end plate. This prevent further neuromuscular transmission and cause prolonged stimulation of the receptor, which desensitize them. Example of depolarization muscle relaxant include the succinylcholine, which can help with tracheal intubation or short surgical periods. Succinylcholine is a depolarizing neuromuscular blocker, meaning it cause a prolonged period of membrane depolarization in order to expert its therapeutic effects. The bind to the postsynaptic cholinergic receptor found on a motor end plate, thereby inducing first transient faction followed by the skeletal muscle paralysis. So first is the phase 1 and phase 2. Phase 1, where the receptor was bind, the sodium ion entered to the muscle, where the positive ion enter automatically. Outer side is negative and inner side was positive. And phase 2, automatically where the gate was blocked, automatically the outer side is negative and this is the inner side was positive. Another type of the non-depolarizing muscle relaxant, also known as the non-depolarizing neuromuscular blocker or competitive neuromuscular blockers, worked by binding to nicotinic receptor on the postsynaptic membrane and blocking acetylcholine from binding. This prevents the motor end plate from depolarizing, which lead to muscle paralysis. The non-depolarizing neuromuscular blocking agent used as an adjacent of general anesthesia to facilitate the tracheal incubation and the provide the skeletal muscle relaxation during the surgical period. So these are the yellow ball is considered as acetylcholine and the orange ball was considered as a neuro muscular blocking agent, and this is the receptor where bind to the acetylcholine automatically, where the neuromuscular blocking agent come and bind to the receptor automatically. Then acetylcholine cannot bind to the particular receptor. This means the blocking agent is the antagonist of the acetylcholine. Automatically, the nicotinic receptor are already occupied. As a result, acetylcholine cannot bind to the nicotinic receptor. Automatically, our skeletal muscle was relaxed. So these are the two types of muscle relaxant drug, that is the depolarization and non depolarizing muscle relaxant and their mechanism of action. Thank you so much. Another is the common side effect of the muscle relaxant, that is the drowsiness. Most muscle relaxant have a sedative effect on the central nervous system, which can cause drowsiness. The depending on the dose and the muscle relaxant. Another is the common side effect is the weakness, fatigue, and diarrhea. Some muscle relaxation like diazepam can also be used the sedative, anticonvulsant as well as treat the anxiety. Thank you.